Hi, I'm Dr. Justin Coleman, an Australian general practitioner. Today I'm talking about medications, and I'll reveal one slightly amazing trick. See, I'm a busy jack of all trades, but I only have two hands, so I need a team. I know all about diabetes, but I also use my diabetes educator, and I could talk about healthy eating for hours, but I don't have hours, and that's why we invented dietitians. But who can I turn to when it comes to medications? Currently, I use one hand to write new scripts while the other pulls patient information out of the printer. My spare hand flicks through complementary medicine-drug interactions, and on the other hand, my other hand is crossing out unnecessary drugs. I use both hands to demonstrate asthma puffers while my right hand opens the door to students waiting for their pharmaceutical tutorial, and my left hand pokes my registrar into running it for me and stop. What I need is one slightly amazing trick. What I need is a pharmacist. I don't mean my local pharmacist down the road. They already do a great job dispensing medications and providing health advice. No, I'm talking about a pharmacist in general practice who can see my patients in my surgery. Someone very handy. Meet Ollie, a non-dispensing pharmacist, rumoured to be able to do 8 things at once. She's as likely to suggest stopping a medication as starting one. Good for patients, good for doctors, good for the budget. When Ollie does a home medicines review, she'll have met the patient before and can arrange follow-up after. She'll improve adherence to the things that really matter and discuss those that don't. Blimey, she could even enter all the medication on my practice software for me to check and sign. I'm not going to miss sorting that overflowing bag when I ask patients to bring in their pills and scripts. Post-hospital? See Ollie first. Medication misadventure costs Australia $1.2 billion a year, and having a pharmacist on my team helps the patient and the taxpayer. One study suggests $1.56 savings for every dollar spent on employing the pharmacist. Stable disease management, fewer hospital admissions, happier patients. Half of all older Australians take 5 or more medications and 10% take 10. Side effect profiles multiply, and the evidence is more pills means worse patient outcomes. We should repeatedly assess whether medications can be reduced or ceased. Ollie can lend a hand or two. Pharmacists in general practice are educators. Why get the latest drug information from industry reps when you have an independent expert on tap? Some new drugs are game changers, but I also want to know which drugs are meh. Drug reps don't do meh. Med students and registrars will have a ready source of education, and Ollie is your in-house researcher next time you and your colleagues discuss opioid policy or how to deal with drug interactions in patients who take complementary and alternative therapies. 2 things I value about general practice are the art of independently applying best evidence to the needs of my patient and continuity of care. Ollie enhances continuity between general practice and hospitals and even stretches all the way to the local pharmacist. So far, the few pharmacists who have entered this space are loving it. We need more. This is community patient care at its finest, and general practice is a place for pharmacists to shine.